Evening. I'm about to be speaking with Meagan from Laurel Fertility Care in California, San Francisco, California. She is a nurse practitioner, and we're going to talk about the dreaded 2-week wait. Loads of you have had questions around it, so we're going to be going through those and the commonly asked questions. They've written a fantastic article all around it, which I'll be sharing very, very soon. So welcome any questions as we talk. Please feel free to ask, as I know that it's a very, very anxious time. Hi to those who are joining. We're talking about the 2-week wait tonight with Meagan, who is a nurse practitioner from Laurel Fertility Care in San Francisco, California. So I'm just waiting for her to join now. The kind of questions that people were asking before, here we are, were around activities during the 2-week wait, how to keep calm, how to keep sane, what to eat, blood flow, all of those types of questions, which we'll touch on tonight as well. Hi, Meagan.
Hello.
It's lovely to be speaking with you today. I've just given you a brief introduction, but if you could just tell everyone who's watching a bit more about yourself and Laurel Fertility Care, and then we're going to start talking about the 2-week wait.
Sounds good. Thank you for having me aboard today. Happy Wednesday. My name is Meagan. I'm the nurse practitioner here at Laurel Fertility Care. I'm also at the egg donor gestational carrier coordinator as well. And I've been here for a little bit over or close to 2 years. And it's been an exciting journey helping people try to, start their family.
Mm-hmm. Mm-hmm. And I know we've already talked about this in advance, but so many people wrote in from the Instagram polls that we recently ran around their concerns and questions they wanted answered about the dreaded 2-week wait. Mm-hmm. So I'm going to ask you some of those questions, if that's okay, the commonly asked questions, and then we'll just open up the floor for people to ask for your advice around tips for coping and kind of recommendations to get through that difficult time. So a question that comes up a lot, which you probably get asked by your patients, is around swimming. Is it advisable not to swim after you've had an embryo transfer?
That's a really good question. We actually do advise for our patients no submerging in water until perhaps their first OB ultrasound with us, so that we know that everything looks good, everything is stable with the pregnancy. So again, no submerging in water, so no baths or swimming, unfortunately, until we clear you two.
And is that because obviously when you submerge yourself into water or jump into a pool or have a bath, water goes up into the vagina and you're concerned about the risk of infection that could bring potentially? Is that why?
Yeah, there's always a little bit of risk of infection there, but it's very rare that it's going to, go past the cervix into the uterus to disrupt anything going on, but we know that this has been a long journey for you. We want to make sure everything is good and 100% before we clear you to go back to some of the other normal day-to-day activities.
Mm-hmm. Makes sense. And I guess what's another 2 weeks after you've been going through this long process anyway, right?
I know, it's a dreaded 2 weeks. It can feel like forever, but we just want to make sure that everything is done, as well as we could to give the best shot.
And someone just asked, does that include the C as well? And I presume the answer is yes.
Unfortunately, yeah.
Mm-hmm. Okay. And what about exercise? Because I'm sure you have patients asking you, how much exercise can they do? Like, what's okay? How much time should you spend relaxing? And how much time should you spend kind of keeping the heart rate going?
Mm-hmm. Again, a super great question. So typically after the embryo transfer itself, we do recommend that patients pretty much relax and avoid any sort of heavy lifting or strenuous exercise for at least the first 48 hours. So it's going to be a perfect time to just Netflix and chill, do anything to kind of take your mind off things, and totally get that exercise is sometimes people's way of dealing with stress or relaxing, and you can go back to some activities. I just wouldn't recommend doing anything super duper strenuous where you're carrying weights over 15 to 20 pounds or doing any sort of HIIT workout, super intense twisting, turning type motions. But again, getting the heart rate, exercise is important. Getting blood flow is important. So I wouldn't say you should stop exercise. Just always check with your provider as well if there's specific types of activities that you like to do, just to make sure that you're in the clear as we continue the 2-week wait.
That's great advice, thank you. Someone's actually just asked a very good question. Is that the same kind of advice for people who are trying to conceive naturally as well, and then the 2-week wait?
Yeah, I would say, again, like sometimes people trying to conceive naturally or maybe didn't know that they were trying naturally and they do get pregnant and they go about their day to day and maybe did have a really strenuous workout or did do something a little bit more hardcore. And honestly, because of fertility treatment, we just want to make sure that the embryo does stick, that we want to make sure that we're giving that uterus and the implantation as best of a chance that it can. I would say, again, just making sure your body is in a good, healthy state is going to be the best for conception.
Brilliant, thank you. Actually, another question that's come to mind, because it was a question I had because I had treatment in the States, and I know that people aren't traveling as much at the moment. But, you know, when international travel happens again, and I'm sure that there are people coming to you from other spots at the moment too. What about flying after an embryo transfer during the 2-week wait? What's kind of recommended with that?
That's another great question. We do have a lot of patients who maybe do travel internationally, or we also have a lot of gestational carriers who travel internationally as well. So after an embryo transfer, again, generally the rule of thumb that we like to tell patients is to keep it pretty light for the first 48 to 72 hours. So if you do need to make a super long flight, I would maybe wait that 48 to 72 hours after the embryo transfer before hopping on the flight. And if it's going to be a super long flight, I would ensure that you have good blood circulation. So making sure you set a timer, maybe make sure you get up every hour or 2 hours to change position, walk down the flight, go to the bathroom, grab a snack, come back to your seat. So you just want to make sure that you're still getting good blood circulation and keeping it pretty light.
And have someone else carry your bags.
Yes, exactly.
And keeping sane, it's just impossible. Someone just commented just now saying, you know, they've done it, they've been through the 2-week wait many times and it doesn't get easier. What are your tips on keeping sane? And I know that you've written some brilliant points on an article that we've just published on our site from Laurel. So what would you advise people do to sort of distract themselves during this time?
Yeah, distraction is going to be important. The 2 weeks again can feel like a really long time, but I would say a lot of our patients go back to work as long as it's not, again, a very physical type of job that you do and you're not on your feet too long during the day. But going back to work can be a distraction, helping your mind be at ease, making sure you're not trying to take a urine pregnancy test every other day because that could increase your anxiety levels for sure. Lots of catch up on some TV shows and find your support group. That's going to be really important too, whether it's through social media, through forums online, and find support within, you know, your local group of friends and your team at your fertility clinic, because we're definitely rooting for you. There's going to be other questions that come up while you're in that 2-week wait. So if there is something that you're concerned with or you have a question about, feel free to message your nurses, because that's what we're here for, and we want to make sure that you're adequately supported. So if there's anything that we can do for you, to let us know.
Fertility nurses are the best, just you know, almost holding people's hands to get through really tough times like this. Do you have lots of patients messaging you with concerns and anxieties and questions around the 2-week wait?
Yeah, it can be hard, especially since essentially after the embryo transfer, we encourage people to start a pregnancy diet and to act as if you are pregnant. So again, like avoiding alcohol, unpasteurized cheeses, obviously smoking and all of that. So sometimes people have questions about specific foods or diet or supplements. So they'll start asking those questions after the transfer as well, and we'll just emphasize and reiterate with them. Or if they have specific workouts or other medications that they're taking. So we do get in contact with them a lot just to make sure that they're good. And we do check hormone levels depending on certain treatment protocols as well at some point during the 2-week wait. So if you are on any sort of supplementation medication after your embryo transfer, those are things that we want to keep track of and making sure that you're adequately supporting this early pregnancy.
That actually leads me nicely onto one of the other questions, which was, what are the ideal it obviously depends on the person, but ideal progesterone levels that you're looking for?
Yeah, that honestly, it depends. So it could be anywhere between over 10 to over 20. It depends on the type of route of medication. Sometimes people are doing more of a natural cycle for their embryo transfer. So the levels, we're maybe not looking for as high of levels, but if you're doing vaginal progesterone or intramuscular progesterone, those levels are going to be a little bit different. So every clinic will have their sort of protocols of what they're looking for. And once we check blood work, if it's a little bit on the lower side, we always reassure patients it does not mean that you're not going to get pregnant. It's just that your body needs a little bit extra support at this time. And this is why we're checking it early on, even before your first beta, because we just want to make sure that you have that the hormone supplementation that you need. So if we need to make any dose adjustments or anything like that, we let you know early on. And then good. Fingers crossed for that first beta to be positive.
And then people can take progesterone, intramuscular injections, can't they, or the pessaries? And how is it decided which route, what people are going to be given?
Yeah, again, this could vary between different fertility clinics, but here at Laurel, we do typically, depending on the protocol, we do encourage doing the intramuscular just because research has shown that it's just better absorbed into the body. I know it's definitely not the most fun part of any treatment, and it can go on for a while, and we like to teach some tips and tricks to make it a little bit easier throughout the process because you are doing these pretty much daily until early pregnancy. But for that, if it's a different type of protocol, sometimes we do the suppository ones. If somebody has shown, maybe in the past that their progesterone levels were a little bit low and then they were unsuccessful with an embryo transfer, there's other ways to receive progesterone as well, like lozenges, which is interesting as well.
Okay. And what would be your tips for people for the injections, for the progesterone injections?
For the progesterone, it's definitely easier to have somebody else give the injection, but I know sometimes people, if they don't have somebody who can give their injection at a specific time and they have to do it themselves, we do recommend doing like a warm pack, a hot pack, just to help absorb the medication, and then giving a really good massage. So I never recommend people to just give the injection and go to sleep, just because you really want to walk around a bit to get the medication in, because the progesterone is oftentimes in some type of oil. It's going to need a little bit extra love so that it gets absorbed into the buttocks. So definitely a warm pack and lots and lots of massages, just because usually the number one complaint is also that it gets a little hard in that area, and oftentimes it's because it's not getting adequately absorbed into the muscle.
Right, that's really interesting. I definitely had that problem, so that's a really good tip. Thank you.
Yeah.
Someone has just asked about the point that we spoke about to do with alcohol. Would you reckon completely abstaining, or is one glass of wine okay?
We recommend just abstaining from alcohol from the point of embryo transfer on. Again, just to start building that habit of being very sure that we're just giving our best shot, especially going through all of the fertility treatment and making sure that everything is good.
I guess also it's kind of like, if you're going to do something that's going to make you think, oh, if I hadn't have done that, then maybe the outcome would have been different. it might just be
Yeah.
best to avoid it so you don't beat yourself up about what
Yes.
ifs.
There's so many what ifs, but
Yeah.
yeah, that's a really good point that you just made.
Hmm. And I'm sorry, I'm just looking at the other questions that people were having. So, what about the causes for late implantation, and how much should people read into what might be or not seeing implantation bleeding, for example?
Yeah, that's a difficult question. There's so much in fertility that is still unknown, and it's hard to tell sometimes. There is sometimes late implantation that does occur, and I don't have the answer because there's still so much research out there that's trying to discover what causes that, and taking a look at uterine lining and hoping that the embryo just finds its way to implant into the uterus. But again, just still a lot of research out there that needs to be done on that end.
Mm-hmm. One of the worries I had, which I don't know if you ever get asked this, but I sleep on my front, and I was really worried about sleeping on my front after the embryo transfer, and that
Oh,
affecting things. Have patients ever asked you that?
that's really interesting, but I have not had patients ask me about the positioning of their sleep. But
Really?
I do have patients because we do ask for a full bladder for embryo transfer just because it helps straighten out the uterus to help the implantation go a little bit easier when we insert the catheter. And right after the transfer is done, you can hop off and go to the bathroom right away. And I do have patients who are like, is it going to fall out? But
Yeah.
no, your embryo, once we place it, your embryo's there. You are definitely okay to hop off and go use the bathroom.
Mm-hmm. Yeah, I've heard that. Well, I had that concern. I mean, loads of people have it, don't they?
Yeah.
And one of the things I love about Laurel Fertility Care is the emotional support that you give your patients as well. And you were just saying before how important it is to find that support group and that support network. And I love that you look after your patients so holistically, because it's such a big thing. And so, you know,
Yeah.
you've had your hand held in terms of the treatment going through it, and then it can feel quite scary coming to the end of your treatment and not knowing what's going to happen next, and sort of not
Yeah.
having that routine. So I think that's great. And then we've had some other questions, but I think that they're more kind of fertility. They're not so much about the 2 week wait. It's more about IVF in general. I'd love to ask you whilst we're here, and if anyone else has any questions around the 2 week wait, please feel free to ask whilst we've got Meagan here. You mentioned obviously eating as though you're pregnant, so not drinking and also eating, you know, avoiding shellfish and the other things that people avoid when they're pregnant. Is there anything that people should be looking to eat actively, like actively eat, rather than just things to avoid?
Yeah, good balanced diet is always going to be important. One of the websites that we actually like recommending to patients is the babycenter.uk.
Yeah, yeah.
That's we there's plenty of handouts there that we love to
Uh-huh.
recommend to patients, but increasing a lot of veggies. Sometimes people do complain about constipation once they're somewhere in their transfer cycle, and even once they're pregnant, constipation and changes in your gastrointestinal system can oftentimes happen. So making sure lots of fiber intake. And we do, of course, encourage prenatal vitamins. So
Mm-hmm.
if you weren't already taking that during your transfer cycle, we definitely recommend starting that and having at least 400 to 600 micrograms of folic acid in the supplementation. So that's going to be really important as well, just to make sure baby's nice and healthy.
Definitely, definitely. We've had some questions come in around testing. Now, I know that you spoke about this before, and I'm guilty of this, and you've written about this in the article that you've just done on our website. But when is the earliest that you would let your patients, or sorry, advise your patients to test? And would you recommend, after treatment, would you recommend that they come in for their blood tests over an at-home kit, for example?
Yeah, we always recommend to, of course, wait for the blood test because that's going to be the most definite response and answer to your long-awaited question. And again, that can feel like a very long time. Typically, if it's an embryo that we transfer that's a blastocyst or day 5 or 6 of its development, we generally have people test about 9 to 10 days after the embryo transfer for their first beta HCG pregnancy blood test. Just so that we're sure that it's a good starting number. And then if it's positive, then we have you recheck in 2 days so that we can see that it's appropriately rising. So blood tests. And I know a lot of patients want to take a urine pregnancy test earlier on, which if they do, we don't, they do, but we will for sure, of course, double check and triple confirm with the blood test. And it's also important to know, like, even after the embryo transfer, depending on the type of treatment that you were on, you might have had a little bit of HCG, which is what we test in the blood to see if you're pregnant. So if you were on some type of treatment that had you have a little bit of HCG in your system, it could be reading a false negative if you are taking your pregnancy test. And we just don't want you to be doing that sort of test way too early. So if you're not sure of the appropriate timing, blood is always going to be the way to go.
Okay. Someone's actually asked, is that the same with natural conception as well? If someone's waiting the 2-week wait, should you wait to test at home, after those 2 weeks as well?
Yeah. So typically with natural, we would say about 2 weeks after having intercourse when you think you may have ovulated, and then checking urine pregnancy test at that time.
And what about your period? If the cycle sadly hasn't been successful, you advise people to stop taking progesterone straight after the bloods, and then they have to wait for their period to come back?
Yeah, essentially. So unfortunately, like if the blood test does show that you're not pregnant, we do advise patients to stop all their medications, and generally the period comes back in about 7 to 10 days, but oftentimes it depends on what your hormone levels were at the time. We've had patients who maybe had very high progesterone levels and they're feeling those pregnant side effects, a little bit of the nausea, the increased fatigue, the breast tenderness, all of that from the progesterone itself, not necessarily them being pregnant, unfortunately. So if the level's super high and we have them stop all of a sudden, there will be the drop, but it's going to start declining a little bit slower. So they could be waiting a whole, possibly 2 weeks for their period to come back. So it's just important to keep that in mind and keep your clinic updated with that part.
Yeah. Absolutely. Thank you for that. We've touched on implantation bleeding. Someone's asked how common that is. Is it common, or is it not very common?
It's quite common. It doesn't mean everyone has to have it, so don't freak out if you don't have any sort of spotting, of course. But oftentimes implantation bleeding can occur like anywhere between 3 to 7 days after the embryo transfer. And it could, maybe just be a little drop or two on your underwear to needing an actual panty liner. So that could be something that happens every single day. And this is where you'd also be touching base with your clinic, making sure it's not turning into a full bleed, but it can be quite common and even last throughout the first trimester of pregnancy, which is a while of just feeling this light spotting, which can be a little bit scary, but again, it takes a lot. So once the embryo is in the uterus, it's essentially burrowing its way to make a little home there, and it can cause a little bit of pain and cramping, and it can cause a little bit of bleeding.
Great. So that was the question I was going to ask, because someone's just said, what about implantation cramps?
Yes, the cramping can be common. It should not be affecting your day-to-day. Like, you should still be able to go to the bathroom and have a nice meal without feeling like you need to curl up in bed. So if it is feeling very intense, definitely let your provider know. It is safe to take a little bit of Tylenol for cramping in the beginning of pregnancy. So if you need to take something because it's getting a little bit painful, you can, but again, always, make sure your clinic is aware that you are having those symptoms.
And as you said, progesterone can be causing these symptoms too, can't it? Because I had cramping on a cycle that worked and a cycle that didn't work. So it was just
Yeah.
impossible to know what was pregnancy happening and what was progesterone.
Mm-hmm. Yeah.
And I think one of your best pieces of advice as well, even in the article, is try and stay off Google.
Yeah. Yeah, try to avoid Dr. Google, even though a lot of the times it's very difficult to, but when in doubt, always consult with your fertility nurses and your fertility doctor.
Someone has just asked, I've had a positive urine test 7 days post 5-day transfer. I have my blood test on Monday, results on Tuesday to confirm. I'm on Cyclogest, and these are UK brands. Could this influence the positive result?
Sorry, I didn't quite catch the last part of the question there.
So it's 2 different brands. I think they're UK brands, and it was just asking whether, I think what she's asking is whether those progesterones could, I'm not sure actually, Lydia, could this influence the positive result? Whether this could, maybe being on 2 drugs could influence the result, but I would probably suggest speak to your healthcare provider if you're concerned about that. And then people have been asking about folic acid and supplements as well. What do you normally advise to your patients around that?
We're all for it, just to prevent, neural tube defects. And a lot of prenatal vitamins, again, contain folic acid. So check the back of your bottle, make sure you're getting at least 400 to 600 micrograms a day, and starting that pretty early on. And I know sometimes people wait until they're actively trying to conceive before starting a prenatal, but even before then, it does take some time for your body to adjust to medications and have some type of effect. So start that. I'm taking one now. I'm not even looking to conceive in the near future, but I'm just trying to get in the habit, because oftentimes with fertility and fertility treatment, it's building the habit, doing your injections around the same time every day. So building the habits are always good.
And why is it important to do it at the same time each night if you're doing it in the evening, the progesterone?
Yeah, so essentially we're trying to mimic like what the body would naturally be doing, which hormones are in a way very, very timely for the most part. So the thought process is just keeping it really consistent will help your body just adjust and hopefully, have a good, successful pregnancy.
Yeah. Amazing. Thank you so much. If you've got any more questions for the team at Laurel Fertility Care, then please do send them over. You can send them through Fertility Help Hub or contact them directly. And as I said, you've written a brilliant article for us all around this huge topic. And so thank you so much for the ongoing support that you give the community and beyond.
It's my pleasure. Thank you for having me on board.
It was lovely to chat. Thanks everyone for joining. Bye.
Good luck.
Bye.